So I don't know if you've noticed, heard people coughing around town, but respiratory illness is on the rise after the winter holidays. COVID and flu are both surging and there's no peak in sight, so we're going to keep going upwards. Dr. Carrie Jenner is a pediatrician with Virginia Mason Franciscan Health. She's also board president of the Pierce County Immunization Coalition, and she joins me now over Zoom. I'm so glad to have you here this morning. Welcome to the show.
Thank you.
So it seems like every time we turn around, you're hearing somebody's with a raspy voice or deep coughing. So what are you seeing in your practice right now?
Yeah, absolutely. The fevers and coughs are here. We're definitely seeing increased flu, COVID, and RSV. And I think it's only going to keep increasing the next couple weeks after the holidays, where people traveled a lot. So we're definitely seeing flu, COVID, and RSV, the quote triple-demic, but also regular croup and regular old colds.
Okay, so let's talk about RSV for a moment if we can, because I was so concerned with my children. I know it's common in children, but anyone can get RSV, right?
Yeah, and in fact, most kids have had an RSV infection by the time they're 2. So it's very present. It's really the young infants under 6 months and older people who really have the most problem with RSV. But it's a very common cold virus. It's just more severe in the young and the old.
Okay. So this is, we were talking about this, I feel like in the media a lot right now. They're like, everyone's sick. But this is kind of the normal time of year for this, right? Or are we seeing a heightened sense of illness?
So absolutely, it always is worse in the winter. Viruses love cold weather, they replicate faster. And then we're in larger groups, we're inside gathering for family gatherings, people are traveling, going through airports. So it's a normal time that these things spread. However, we are above normal for flu and RSV hospitalization. So it does seem to be, it's higher than it was last year. So it definitely is increasing.
Okay, that's good to know. You talked about flu, we talked about RSV. Let's talk about this new COVID variant. What do we need to know about this? It's JN1?
Yeah, JN1. It is. It's the predominant variant. About 62% of all cases, according to CDC, right now. It seems to be more transmissible, but the good news, it's not more severe. So it is definitely increasing. And the good news is that the current COVID vaccine, the current COVID tests, and the current treatments like Paxlovid seem to work for JN1. So that's good. But it definitely is the prevalent variant, and it's an offshoot of Omicron.
Oh, okay, that's good to know. And actually, since I have you here, board president of the Pierce County Immunization Coalition, can I ask you about vaccines? Because I know a lot of folks, people I know and love, are very hesitant to get that mRNA vaccine. But I understand there's another one. I think you just mentioned it. It's the Novavax?
Yes, so Novavax is one of the options for COVID vaccination that is not based on the mRNA technology. So that is an option for people 12 years old and up to get if they have concerns. However, the mRNA vaccines are working well. We've given millions of doses. The technology is not that new. It's been around for over a decade. It's newer in vaccines. But yes, if people are hesitant for mRNA, there is a Novavax that is made kind of the old-fashioned way.
All right, that's good to know. I'm glad I asked you about that. I also want to ask you about the flu right now. I'm going to get to maybe the flu shot in a second, but I want to look at the latest map from the CDC, which shows much of the country, including Washington, in the high to very high infection category. The South seems to be getting hit the worst. Is it true that the Pacific Northwest tends to lag behind the South, or is that just something that we may hopefully avoid and just kind of this is as bad as it'll get?
No, so flu definitely tends to start in the South and the East and then head west. So what's happening in the South could be a precursor to what we're going to see here in the Northwest. So to me, that means that we could be seeing an increase in flu these next couple of weeks. So it's not too late to get your flu shot.
You just answered my question. How is this strain of the flu shot working for this strain of the flu?
So far, we think it's a pretty good match. It always takes time, but and remember, no vaccine is 100%.
Right.
But the reason to get it is to prevent severe disease and also to prevent spreading it to the vulnerable young infants under 6 months who can't get the flu shot or older people. But it seems to be working well, and we really recommend still getting your flu shot if you haven't.
Okay. So speaking of the vulnerable, when does the medical community start to get concerned when they see these maps and these numbers?
Yeah, so we really look at kind of hospitalizations and bed capacities. We're not there yet. We're definitely, increasing in flu and RSV, but we're not to a level that we are concerned about bed space. However, these things can increase quickly, and I recommend that people, get their vaccines, hand wash, to do what they can to prevent getting these respiratory illnesses and preventing be hospitalized.
Last question. You just mentioned washing hands and everything. What are some other like the best ways to protect ourselves? I actually wore a mask when I traveled. Are masks still good? Should we still be wearing those in big spaces? Like, what's your advice on that?
Yeah, that's a great question. So I advise my patients, if they're going to be in a large indoor setting with lots of people, I think it's a good idea to wear a mask, such as an airport or a large concert that's indoors, because these things spread quickly. This new variant JN1 seems to be very transmissible. So if you're going to be in a big, large, enclosed place with a lot of ventilation, I would recommend wearing a mask. But at home or just normal day to day, it's not needed.
All right. Thank you so much, Dr. Jenner. I really appreciate you taking the time for us today. I know it was kind of last minute, but we really wanted to find this out. So we are so grateful to you. Thank you.
Absolutely. Thank you.
All right.